Expanding the definition of trauma in psychotherapy beyond the criteria outlined in the DSM-5 can have both potential benefits and risks. While acknowledging the subjective nature of trauma experiences is important, there are negative outcomes associated with a broad and subjective approach. Here are some potential drawbacks. Overpathologizing normal stress responses. Broadening the definition of trauma to include any event perceived as traumatizing may lead to overpathologizing normal stress responses. Everyday stressors or challenges may be mislabeled as traumatic, potentially medicalizing common life experiences. Subjectivity and lack of specificity. A highly subjective approach to trauma may lack specificity, making it challenging to establish clear diagnostic criteria or treatment guidelines. The absence of clear criteria may contribute to diagnostic ambiguity and variability in treatment approaches. Validation challenges. While acknowledging subjective experiences is essential, an overly broad definition of trauma may make it challenging for therapists to validate and prioritize experiences, potentially diluting the significance of more severe trauma experiences. Therapeutic inefficiency. Expanding the definition of trauma without clear criteria may lead to therapeutic inefficiency. Therapists may spend time addressing perceived traumas that do not meet established criteria for trauma, diverting attention from more pressing clinical concerns. Resource allocation issues. An overly inclusive definition of trauma may strain mental health resources by increasing the number of individuals seeking therapy for experiences that may not necessarily require trauma-focused interventions. This can impact resource allocation and availability for those with more severe trauma-related needs. Impact on insurance and legal systems. Broadening the definition of trauma may have implications for insurance coverage and legal systems. Insurance reimbursement and legal definitions of trauma often rely on established diagnostic criteria, and an expanded definition could create challenges in these domains. Ethical considerations. Therapists must navigate ethical considerations when working with clients who perceive events as traumatic but do not meet established criteria. Balancing client autonomy and the responsibility to provide evidence-based interventions poses ethical challenges in such cases. Stigmatization and victimhood. A broad definition of trauma may inadvertently contribute to a culture of victimhood, where individuals may identify strongly with a traumatic experience, potentially hindering resilience and adaptive coping. Impact on research and treatment development. An expansive definition of trauma may complicate research efforts to understand the etiology, prevalence, and treatment of specific trauma-related disorders. Clear and specific criteria are crucial for advancing evidence-based practices. In summary, while it's important to acknowledge subjective experiences in therapy, expanding the definition of trauma beyond established criteria can have several negative consequences. Balancing sensitivity to individual experiences with the need for specificity in diagnosis and treatment is crucial to providing effective and ethical mental health care. Therapists must carefully consider the implications of adopting a broader definition of trauma in the context of both individual client care and the broader mental health field. This video is intended for educational purposes only and in no way is intended for psychological, legal, or medical services. If you believe you could benefit from mental health services, please seek the help of a licensed mental health professional.